The Navigator project is a hospital-based programme that works with young people aged between 10 to 25 that are presented to the emergency department with an injury as a result of being involved in a violent crime.
So they're not connected with the police or children's services or even the health service. They're there for that young person to kind of build around them with their permission the kind of support from wherever it might need to come that's going to help them with their particular situation. So they can really say they stand alongside the young person. They've not got another agenda from another agency at all.
So doctors, nurses and other clinical staff working in hospitals have a lot of expertise in managing the injuries themselves, making sure children and young people have the appropriate medical treatment. We also focus on keeping young people safe in the immediate aftermath of an incident. But what we don't really have expertise in is linking young people in with community projects, with sports projects, arts projects, linking in with their schools and communities. And so by being able to refer to the navigators, we can really enhance the offer that hospitals have.
It's a really brilliant model because it means that regardless of whether we're involved, ongoing and in the future, there's always somebody for that young person to go to offer support and help.
Yeah, no, the project we've been just running since April, May this year. It is early doors for us, but already we can see really good success. We're seeing really positive engagement with hospital staff. Navigators really quickly becoming embedded and becoming a really essential part of the ED team. But also we've had about 68 referrals. We've got young people who are working with the navigators, and what we're doing is getting a really strong evidence base for why it's needed and how best we can approach the service. We have 4 navigators. We've got an administrator. The 4 navigators are all coming from different backgrounds in youth work, in care homes, statutory organisations, but they're coming together with a desire to help to make a difference in young people's lives, to help reduce kind of the impact of violent crime that is happening for our young people. But they're coming, as I said before, from that kind of relationship perspective, building relationship with young people, gaining their trust, working with them to make a difference.
The navigators will offer to work with those young people to address anything that's led up to them being in that situation. So we work with some amazing partners out in the community that can really address things right the way through from finances, education, counselling, anything that they really sort of feel that they need addressed. So we've got youth workers that are based in the ED department that will approach those young people and offer that service. And if they want to work with us, we're here and ready to work with them.
Well, I'm very encouraged that in the first few weeks that the Navigator programme has been operating, I think there've been over 68 referrals now. I've just been talking to some of the navigators, and they tell me that the service is really kind of bedding into the 4 hospitals. The nursing and the medical staff are getting to know them. The referrals are coming through those members of staff. They are thinking when a young person comes in, Navigator programme, which is what we want. Obviously, we will be evaluating it because we want to see, beyond that point of contact and getting the referrals in, what difference does this make over time to those young people that the navigators have worked with? Can we see any evidence that it is actually helping them with whatever their problems are, and therefore staying out of dangerous situations in the future? So we will be evaluating it, and depending on the evaluation, we'll build out from there.